This video talks how it can lead to Eisenmenger syndrome and how surgery is important to ASD and all those things, talking about all of them, starting from ASD. So what there is an opening between the two atria to flow from the left side to the right. From the left side, that's because pressure in the left side, right side, causing the flow from the left side. So as there is to the right side, do you think that the pressure in the right atrium is going to increase more than it should? I mean, pathologically, yes, it would, because there is more blood flow. And do you think the pressure in the right ventricle is more than it should? Absolutely. As a result, the pressure in the pulmonary artery is also going to increase more than it should, right? This causes pulmonary hypertension. And over time, what happens is there is medial hypertrophy of the pulmonary vessels. Okay, there is laminated medial hypertrophy. USMLE is a game of words, so you have to be familiar with some of the terms that they use. So whenever we're saying medial hypertrophy of the pulmonary vessels, don't be surprised if they say laminated medial hypertrophy. So as a result, what happens is there is pulmonary vascular resistance. Because of increased blood flow, the resistance of pulmonary vessels is going to increase. As this problem becomes more and more severe, pulmonary resistance becomes so bad that very little blood flow goes to the lungs. That's when also there is reversal of shunt, right, from the right side to the left side, because there is also right ventricular hypertrophy, there is right atrial hypertrophy. All these is causing a reversal of shunt from the right side to the left side, which we classically know as Eisenmenger syndrome. As this becomes progressively bad, the late onset of Eisenmenger syndrome, we're going to see clubbing, we're going to see polycythemia, and we're going to see cyanosis. These are late onset of Eisenmenger syndrome. So late onset of Eisenmenger syndrome. So now let's talk about surgery. So what happens? There is changes in the pulmonary vessels. There is change in the right ventricle and the right atrium. Right, 3 spots have just because of the ASD. Now with surgery, we need to do surgery before it gets really bad, and the surgery should close our ASD. And the reason we need to do surgery is because we need to protect the heart from having too much hypertrophy in the pulmonary artery. We don't want too much hypertrophy in the pulmonary artery, and we want to make sure that that does not happen. And the reason we are more concerned about the pulmonary artery rather than the left and the right ventricular hypertrophy is because this change is irreversible. This change is reversible. Okay? So if we correct the ASD, if we close the ASD with surgery, that is not going to lead to so much pulmonary resistance, and the heart will eventually get back to normal morphology, right? But if the situation becomes so bad, if we let this get so bad that we don't do anything with the ASD, and the ASD remains, and there is pulmonary hypertension keep on happening, and there is hypertrophy of the pulmonary vessels, this situation is going to be irreversible, and the patient can die from heart failure, right? So we want to prevent pulmonary hypertension. That is our main goal, right? With the right ventricular hypertrophy and right atrial hypertrophy, that would get back to normal with time. So the last thing I want to talk about is that with ASD, you are also going to hear wide split, right? We're going to hear wide split. I made a video on the different types of splittings and why it happens. If you're interested, please go back to that video and watch that. And I explained why ASD has wide split. And I'll say it quickly here. We have wide split in ASD is because the factors affecting the right side and the left side equalizes instantly, right? So as a result, it leads to a fixed wide split. Yes, sorry, I forgot to mention fixed. It has to be a fixed wide split.